Hello, I am Jeanne Zenge, Assistant Professor of Pediatrics in the section of Neonatology, and I am the lead neonatologist for neonatal telehealth services at the University of Colorado. I have the privilege of talking to you today about the Neonatal Telemedicine program at the Children's Hospital Colorado. Globally, the adoption of telehealth in neonatology is a more recent phenomenon. At Children's Hospital Colorado, however, for the past couple of years, we have been providing a few telehealth opportunities to improve the care of neonates and other patients needing neonatal and pediatric expertise throughout Colorado and regionally. Telehealth, in general, provides the ability to improve or enhance communication between a family and the patient, as well as between one provider to another. As Children's Hospital Colorado Neonatal ICU is a 7-state regional referral center, we have patients whose home environment may be several hundreds of miles away. As a result, parents may not be able to easily relocate to Aurora to be with their child. Children's Hospital Colorado has the capability to provide video contact between the long-distance family member and the patient. The system is protected and HIPAA-compliant to give families reassurance that their child and their child's image are safe. With the onset of the coronavirus pandemic, communication between families and patients has been challenging, and this service provides one way to help reduce the anxiety of not being physically present. In addition, telemedicine sessions between Nicu providers, such as therapists, have been one strategy to maintain ongoing communication with family members about the care needed for their child. For a few years now, the neonatal providers at Children's Hospital Colorado have provided a tele-sign-out option in addition to the traditional written discharge summary to primary care providers of medically complex children being discharged from the NICU. This audio-visual conference includes the neonatal provider, the primary care provider, the patient, and any pertinent subspecialty representatives in the patient's room. The parents are always invited and often are present during these sessions, and tele-sign-outs can occur any time prior to discharge from the NICU or at the first primary care provider's visit. During the session, the neonatal provider and any present subspecialist review the baby's hospital course, diagnoses, and discharge information such as medications and follow-up care. Physical findings can also be shown to provide a baseline assessment of the patient, and/or special care needs such as wound care for abdominal wound defects can be simulated for the primary care physician if needed. This service has been well received by many community providers, particularly those who are outside of Colorado. Our discharge coordinator organizes the tele-sign-out sessions for medically complex neonates as part of the discharge process. However, a primary care physician can request a tele-sign-out for any NICU patient by contacting the NICU discharge coordinator, whose information is on the slide currently shown. Most recently, as of October 2019, we have started a teleconsultation service where instead of a traditional phone consultation, a community provider can request a neonatal teleconsultation. A dedicated team of neonatologists are available 7 days a week from 8 a.m. to 5 p.m. to provide video conferencing to help assist with visual diagnosis such as dermatologic abnormalities or evaluation of dysmorphic features, assessment for need of transport, general recommendations, and/or procedural guidance for urgent interventions such as needle decompression of a tension pneumothorax. Currently, we provide this service to select providers in Wyoming and Colorado with a growing number of interested hospitals throughout the region. Future plans include the expansion of the teleconsultation service to 24 hours, 7 days a week, and teleresuscitation. If you have any further questions about the neonatal telehealth services available at Children's Hospital Colorado, please feel free to contact me at the email address provided, and thank you for your time.